Thank you, Governor. Good afternoon. So we are now at 415,200 cases, and as the Governor mentioned, over 10,000 deaths, 10,213 confirmed as of yesterday. I can tell you that these cases and deaths are not just numbers. These are people's family members, their friends, their colleagues, and every life lost was an important one. I'm an ER doctor, and I just worked a shift in the emergency department this past weekend. I can tell you that people are not just automatically recovering from this virus. This is not a cold that you just get over. Many people are still presenting to the emergency department weeks after they have been diagnosed with complications. And we are still learning more and more about the long-term health consequences of having this. So we just have to remain vigilant. So here's where we are on the 3 key metrics that we are tracking. Cases are at 514 cases per million people per day overall as a state, and have been declining for the past 19 days. All areas of the state have seen a decline in the case rate. The percent of tests that are positive is at 14%. This number has been fluctuating up and down for the past few weeks, but has not changed significantly and is still quite high. Hospitalizations are trending down overall for the past week and decreased in all but 2 regions in the state. Currently, 19% of inpatient beds have COVID-19 patients in them. We've seen a slight decrease in testing as well. The state averaged a little over 56,500 tests a day last week compared to over 59,000 tests per day the previous week. It is so important that people seek a test if they feel sick or think they may have been exposed. That is the only way we will be able to know exactly where this virus is so that we can slow its spread. There are hundreds of testing sites across the state, and many of them are free. You can go to our website, michigan.gov/coronavirus test, to find the one that is nearest you. We also continue to focus on contact tracing. We are still seeing far more cases every day than our state and local health department staff are able to keep up with every day. This means that there are people with the virus who may have a delay in getting in touch with a public health professional to talk to them about their close contacts. These close contacts risk having the virus themselves and spreading it to others. One way we can all help solve this problem is to download the My COVID Alert app. This is a free app that protects your privacy and lets you know if someone you have been in close contact with has the disease. You can download it in the App Store, or you can go to our website, michigan.gov/coronavirus. So as the Governor mentioned, our team at MDHHS is actively preparing to be able to distribute a COVID vaccine when one is approved. This could happen as early as next week. A vaccine will only be approved when it has gone through 3 phases of clinical trials, including tens of thousands of people. And the top scientists and doctors in the country have reviewed the data and determined that the vaccine is actually safe. There are 2 vaccines right now that are in the final approval processes. Once they are approved, we expect to receive a limited allocation of these vaccines and expect to receive shipments every week that will go to our hospitals, our local health departments, our pharmacies, and other partners. Based on recent estimates from the federal government, Michigan will receive about 84,000 doses of the Pfizer vaccine if it becomes available next week in that first allocation. The Moderna vaccine is a different vaccine that is just behind the Pfizer vaccine in the approval process. If it is approved, and that may be later on this month as well, recent federal estimates suggest we will receive about 173,000 doses of this Moderna vaccine in our first shipment. These are both estimates and depend on the federal government and the manufacturing process. The amount and the timing of these shipments could still change, but we are still making plans to send vaccines to hospitals and local health departments across the state that have the ability to administer and store them. As the governor mentioned, the first priority for vaccination will be frontline healthcare workers, as well as people living and working in long-term care facilities. As we get more vaccine, we'll be able to offer the vaccine to more and more people, including other essential workers, people who have underlying medical conditions, and people who are over the age of 65. We hope that by late spring, we will be able to offer the vaccine to the general public. It is important that every adult in the state starts making plans for getting the vaccine. Talk to your doctor now about your risk factors and when the vaccine may become available to you. Know that you will need to get 2 doses of the vaccine, spread 3 weeks apart if you get the Pfizer vaccine, or 4 weeks apart if you get the Moderna vaccine. And it is very important that you know what to expect. These vaccines work by preparing your body to fight the real virus if it comes into contact with it. That means that many people will get mild symptoms after getting the vaccine, like a sore arm, a low-grade fever, or general malaise. That is something to expect, and it means that the vaccine is working. These are the types of things that you should be planning for and talking to your friends and family about. Also, please go to trusted sources for information on the vaccines. The state already has a website, michigan.gov/COVID vaccine. You can go there and find out information about the vaccine approval process and what to expect if you receive a vaccine. I'm thrilled about the announcement today of the bipartisan Protect Michigan Commission, and I'm honored to co-chair it with the Lieutenant Governor Garland Gilchrist and several other leaders across the state who have been champions for the lives and livelihoods of all Michiganders. Public health should not be political. We are all in this fight to eradicate the virus from Michigan together. I'm excited to work with this group of leaders to make sure Michiganders have the information they need and access to these life-saving vaccines. 2020 has been hard, but vaccines will be available soon. We are cautiously optimistic about the data that we are seeing. I ask all of you to continue to do the right thing. Wear your mask to protect yourself and others from the virus. Wash your hands frequently. It's still not too late to get a flu shot, and you can start planning for when you will be able to get the COVID vaccine. Also, it will be challenging, but we all have to think about creative ways to celebrate the winter holidays this year. There is simply too much virus in our community for us to be able to gather in groups like we normally would during the holiday season. So let's all double down and focus on what we can individually do to end this pandemic here in Michigan.